Hey, Dr. Jim Loden here with Loden Vision Centers. Story on the new Aventa microscope. Rob Hewlett and I began working on the development of this scope about 3 years ago. Rob called me up and said, Dr. Loden, you used my older aluminoscopes years ago, starting up a new company. I'm interested in demoing some scopes with you. We worked with the scopes. The first model actually didn't work real well. I gave Rob the big thumbs down, sent him packing back to Georgia, and he came back months later with a newer model. It continued to improve progressively. We finally got done with the final prototype of the microscope, and it was a great experience with that scope. We had great clarity, we had great visualization for all of our anterior segment procedures. And a little bit about our practice. We're in the midst of building a new ASC. We're about to move in right now. So we were demoing a variety of microscopes. We demoed the Zeiss 700 Lumera, the Lumera I, the Leica scope. We had looked at some used OMPI scopes as well. And we brought the new Aventa microscope in its final version, and we compared it to the other scopes, and we found out, number one, had great clarity, probably better than any of the other big brand microscopes. All three surgeons in my practice loved it. The visualization, the red reflex was great. The overall light was great. And I talked with my surgeons and I said, okay, in moving into this new surgery center, what do you want? I want to buy you the equipment that you want for our premium service refractive cataract practice. And all of them said, Dr. Loden, the most important thing is the microscope to us. It's not just the phacos. We demoed a lot of phaco machines. All of them we can use, but we really want great visualization during our surgeries. So when it came right down to it, we voted on it, and all of us voted that the Aventa microscope was going to be a great microscope. So we purchased 2 of them for our new surgery center that will be opening up in the next month. So we're looking forward to having this scope. From a purchaser looking at this scope, what do you look for? Well, we're looking for the clarity of the image, but as an ASC owner, I'm also looking at the cost effectiveness of this microscope. You love the visualization through the scope. You can attach a variety of different optics to it, observer scopes, cameras, potential for 3D systems. There's a lot of ability to manipulate this scope into different facets of a keratorefractive practice. Rob Hewlett and his team has it set up. You can set up aura intraoperative aberrometry on the scope. It's pre-positioned for a refractive cataract microscope. You can use it as your main OR scope. You can use it for office-based cataract surgery and procedures. It's just a matter of how you want it set up, but I can guarantee you're going to be happy with the visualization of this microscope, as all of our doctors were.